Hi, my name is Lexi. I'm going to be taking you through diaphragmatic breath work. This is a really important breathing technique for everybody to learn. It helps you engage more deeply into your abdominals. Using it throughout a workout can help you protect your spine and your lower back. It also just helps you activate into your abdominals more so with abdominal specific exercises when strengthening in the abs, so then you'll get better results. The exercises will be more effective and they'll be safer when using this type of breath. This is also very important for pre and postnatal women who are participating in exercise, or this can be used just to help you tap into your abdominals to find some gentle strengthening and activation in your abdominals and in your pelvic floor. Today we'll just go over abdominals. Pelvic floor we'll go over in a different video. So let's just come to a comfortable seat. I like to come to cross-legged. If that's uncomfortable, you can find more of a butterfly position. If your hips are tight, sitting on a block or on a pillow can help lengthen the spine a little more and can help you get out of the hips. So take whatever option helps you feel more comfortable. We're going to be here pretty much for the remainder of the video, just going over breath. So first, let's just close our eyes, settle into your space. Let's just take one breath through the nose, in through the nose, and out through the nose. Just releasing any negative thoughts or stresses from your day thus far. All right, now let's go into that diaphragmatic breath. So with diaphragmatic breathing, you take an inhale through the nose, and I like to place my hands on my rib cage. I find it sometimes more comfortable to kind of wrap my arms around me, or you can have your hands like this. But the idea of this hand placement is to feel the rib cage move outward with your inhale. So you kind of feel the rib cage fill into your hands, and then with your exhale, you find that exhale out the mouth through pursed lips, and you feel the rib cage then move down and inward. So you're knitting the rib cage down and in as you blow out that air. So you'll inhale through the nose, expand the rib cage, and then exhale out the mouth through pursed lips like you're blowing out candles. Feel the rib cage pull down and in. So that's the movement you want in the rib cage. Out, and then zip up the ribs, making sure there's no flaring or popping in the ribs with that exhale. With your inhale, you can also expand through the abdominals, through the abdominal wall. We're finding relaxation in the abs during the inhale. Learning how to relax in the abdominals and then also in the pelvic floor is just as important as learning how to activate. So, and that goes for your regular exerciser or someone, especially important for someone who is pregnant or post-delivery. So let's now learn about how to activate our abs with that breath. So let's find our hip points here. First, focusing on our deep low abs. One of the toughest areas to tap into. So if you're having issues feeling that activation there, just be patient with yourself. It will come with practice. So let's take an inhale. So our rib cage is just moving outwards. We're relaxed with our inhale. And then with your exhale, I want you to think about pulling these two hip points, these bony prominences in the front of your pelvis, so they're called your ASIS. Think about pulling those inward. So you're thinking about pulling them towards one another. They won't actually move, but just picture, envision that moving inward. And then as you exhale, you'll think about moving the hip points inward, and as a result, you're going to feel the abs that run across your low belly, just below the belly button, wrap in. So you're going to feel that activation, that contraction in those low abs. So once I find my bony prominences and envision them moving inwards, then I like to take a breath with my hands on that deep transverse abdominal muscle. That's the name of the muscle. And I like to see, can I feel that muscle wrapping inward? And this comes down to that neuromuscular connection, being able to activate by just thinking about it. Also, with your exhale, this muscle will naturally activate. So find that pursed lip exhale. You will naturally increase your intra-abdominal pressure. You'll naturally engage through the low abs to stabilize and activate. Okay, now let's think about our six-pack abs, our rectus abdominals. This is what most people think of when they think abdominals. They're the long abs that basically run from here all the way down to here. So think about zipping up from the pubic bone up to the rib cage, because that's pretty much the length of these abs here. They have a little separation here, and we want to think about pulling those abs inward, connecting them inward as much as possible when we exhale. So take an inhale through the nose, just relaxed, and then exhale out the mouth. Feel those abdominals zip inward, those six-pack abs pull in, closing that gap of space. With this, I like to have my hands around my belly button, and then when you zip up the six-pack abs, you'll feel that belly button lift upward and inward. So lifting and pulling that belly button in kind of goes hand in hand with zipping up the abs from the pubic bone up to the rib cage. And then lastly, you can think about those side abs, those obliques, pulling inward, kind of cinching in your waist. So with an inhale, you're relaxed, and then with your exhale, just think about pulling in those side abs, cinching in those side abs. And then when we put all of that together, you're going to get the full activation. So it's important to practice activating one section of abdominal muscle groups one at a time, and then it's important to bring that all together and activate all of them at once. So we did the low deep abs, we did the six-pack abs, we did the side abs. Now let's combine all three of those muscle groups with our exhale. We're activating all three. So inhale, rib cage moves out. We're relaxing the abs completely, and then with that exhale, out the mouth through pursed lips. You think about creating a brace with your abs. So you're wrapping in the low abs, zipping the six-pack abs, cinching the side abs all at once, creating that strong base, that strong foundation for your spine and your pelvis. Let's go one more time. Inhale through the nose. Exhale. Applying all those cues of pulling in your ASIS bones. You're zipping up from the pubic bone to the rib cage, and you're cinching in the side abs. So apply all of those cues with your exhale. Practice this on your own. This takes time. I'm still working on it. I'm still working on relaxing with my inhale. That's a big part of it, moving the rib cage out. So as important as the exhale is, don't overlook the inhaling either. That's where we'll end for now. Next time, we'll go over how to activate the pelvic floor with our breath work and how to relax the pelvic floor with our breath work. So look for that video, and please like and subscribe. Thank you.